Oh, it's funny.
You're not someone else.
Rita, are you going to be able to? I see it's live. Are you able to set up the the way we talked about the configuration for the screens and everything?
Yes, it's live right now. We're live right now.
Okay.
Yes. Okay, so good afternoon, everyone. My name is Attorney Rita White. I am the current president of the Black Women Lawyers Association of Michigan. I'm so happy to have everyone here so we can discuss this really serious issue that unfortunately we have had to endure for the past close to 3 months now and on. We proudly have been able to have 3 esteemed professionals participate as panelists for our presentation today. We have Lieutenant Governor Garland Gilchrist. Mr. Gilchrist is here to present and answer some questions. We also we also have the Michigan Department of Health and Human Services Chief Medical Officer, Dr. Jonee Caldoun.
Yes, welcome.
Thank you for having me on.
Thank you. And we also have an internal medicine medical doctor. His name is Dr. Arande White. Dr. White, say hi.
Hello, everybody.
Welcome, Dr. White.
Good to be here. Thanks for having me.
Okay, so me and Robin, Attorney McCoy, are going to be bouncing off questions to the panelists. So I'm going to start with Robin, and she's going to open up the questions. But first, we would like if Attorney Mr. Gilchrist, if you would like to give a brief opening statement or an opening comments, we would love to hear.
Sure, I'd be happy to. So good afternoon, everyone. And I really want to thank you for opening up this opportunity for myself, as well as for Dr. Caldoun, if I may be so forward as to say thank you on her behalf for having me here. It's good to be back with BWLAM. I remember coming to see y'all in 2018, and so it's happy to be back here to talk with you about what's really important happening right now as far as how COVID-19 has been specifically impacting communities of color and specifically the Black community in the state of Michigan. Thanks to the leadership of Dr. Caldoun, we have put together, I think, one of the most comprehensive and conscientious responses to this crisis in the country. And all I would say about that, it is evidence that elections have consequences and that representation matters. And so having someone like her in a leadership role has led to the state of Michigan having a very different type of response to this than other states. And I think that as we are beginning to see things trending in the right direction from a public health perspective, that is a testament to that service and to the people of Michigan being responsive to that service. So thank you all for having me today and having us today, and I'm looking forward to conversing with you.
Thank you. And Dr. Caldoun, if you would like to make some statements.
Yeah, so thank you again for having me on today. And thank you, Lieutenant Governor, for your kind words and your strong leadership with this pandemic response. So yes, this has been quite a challenge. My team in the Department of Health and Human Services has been working on this since January, and it became very evident that it was going to be particularly impacting people of color more severely. And so we've really had a strong team at the department across the entire state who's been really working hard to address this. This will be a long-term issue, even when we get to a place where we have a vaccine or we have an antiviral. There are still things we'll have to address, particularly in communities of color when it comes to mental health, substance use disorders, and all the other things that we call social determinants of health. So again, looking forward to the conversation today, and thank you for having me on.
Thank you. Dr. Arande White, would you like to provide some statements?
Hi. Yes, I'd like to thank you all for having me participate in this conversation. I'm happy to participate. I have about 20 years in the medical field experience as an internal medicine physician, both inpatient, outpatient capacities, and obviously this coronavirus pandemic has been unprecedented as far as what we've seen as far as medical professionals in the healthcare system.
Thank you. Okay, so what I'm going to first ask is a question for Lieutenant Governor Gilchrist. Now, what is the objective of the governor's coronavirus task force and on racial disparities? What are your objectives?
Sure. So let me take a step back and give a little bit of the sort of pretext for it, and then get into the purpose of it. So Michigan, well, as Dr. Caldoun said, the state of Michigan got started to get prepared for coronavirus before we had our first confirmed positive test results of the virus being present in our state. And part of that preparation was making sure that we had elements of our public health infrastructure instrumented to be able to track the impact of people in the state of Michigan across different demographics, age, gender, race, ethnicity, et cetera. And because of that preparation work, and because of, frankly, the state of Michigan's pretty rich history with collecting and sharing that demographic data, we were one of the first states and remain one of the few states that share both our coronavirus test results and our COVID-19 deaths information along racial and ethnic lines. And that's important because sort of pretty early on in this pandemic's presence in our state, we saw a quite differentiated impact when it came to the infection rate and the mortality rate of the virus on people of color and of Black people in particular. And because we were able to observe that and saw that it had been sustained, it enabled us to make a choice as a state to respond to this as a state, to not think about this as an issue that's only happening in Detroit, but an issue that is impacting our community statewide, and frankly, communities of color across the state. So we established this statewide task force that is scoped statewide, that is people from all across the state to address this issue. And we really have two goals. The primary goal is to address the increased mortality rate with COVID-19 in communities of color, because that is something that we have observed and measured, and you can't respond to something you cannot observe nor measure, and we've done that. So we're working, so that's the first purpose. The second purpose is to connect the interventions, the recommendations, the actions that are made or that are taken by the task force, connect that to the longer term work of our administration when it comes to addressing disparities in health, disparities in education, disparities in economic opportunity and success, et cetera. Our administration has, since we took office, looked to make investments and build programs and infrastructure to support the eradication of those disparities, everything from our education budget that we passed in our first year in office, which radically shifted equity in terms of education spending across the state, to the task force on poverty that we established in December, which is looking at how we can better organize the many state agencies and programs that somehow are working to reduce poverty, but are not working in a coordinated fashion, to the Thriving Cities tour that I led across the state of Michigan to 19 cities, working and speaking with communities of color, frankly, in most of those places, because that's where a lot of people of color live in the state of Michigan, how we can improve quality of life and access to generational economic opportunity, to even the Healthy Moms, Healthy Babies initiative that the governor announced in February, which specifically looked at the fact that Black women are 3 times more likely to die from pregnancy-related causes or complications than white women in the state. So building on that infrastructure and that momentum and that posture as an administration, we're leaning into how we can have a differentiated impact here when it comes to the racial disparities and these outcomes for coronavirus. And I think that we've been working pretty hard, and Dr. Caldoun is a leader on this task force. We have people on it also, our DHHS, our Department of Health and Human Services Director, Congresswoman Brenda Lawrence. We have a couple of state reps. We have medical professionals like the head of the Detroit Medical Center, Dr. Audrey Gregory, the Dean of the Michigan State School of Nursing, Dr. Randy Rash, and we have 26 or 27 other esteemed folks from different walks of life, faith leaders, community leaders, labor leaders, education leaders at every level of education, young professionals, parents, seniors, homeless advocates, everything in between, because we needed to have a comprehensive lens on this so we could have a comprehensive response.
Great. So in terms of now, Dr. Caldoun, we really want to thank you for your consistent press reports, really notifying the public of the status of the COVID numbers and the how, in terms of the decreasing or increasing mortality rates, because it's important that the communications aspect is really out there. So we really understand really where we need to be, because people out here, a lot of people were just kind of thrown, as probably you in the medical field, was just thrown under the bus where no one was really prepared for this. So what is your, Dr. Caldoun, what is your specific role on the task force?
Yeah, so my specific role in the task force is obviously to support the leadership of Lieutenant Governor Gilchrist, but also to make sure in our public health response that I'm leading in the Department of Health and Human Services that we really integrate the work we're doing when it comes to, for example, communications and testing and making sure that we're giving people an opportunity to isolate appropriately and that we're having culturally competent directions when we're talking to community members. My role is to really make sure we're integrating our broader response into the Racial Disparities Task Force very seamlessly.
Great, thank you. Attorney McCoy, would you like to ask the next question?
Yes. Well, I'll start with Dr. White. So how long have you been a doctor?
I've been a doctor for about 20 years or so.
Okay, and then it's my understanding you specialize in internal medicine?
Yes, internal medicine. I've done both outpatient and inpatient medicine.
Okay, and then have you had any experiencing during this pandemic directly working on, helping with people who have the COVID virus?
Oh, yes, yes. I've had a number of COVID-19 patients, and the challenges in dealing with those patients are not like other illnesses, as you've already heard.
Okay, and then what tips do you have for combating the virus? That's part of why we said we wanted to have this informational session, have the Lieutenant Governor, have Dr. Khaldoun, have yourself, because there's a lot of misinformation that's out there, and we want to make sure that the public gets the proper knowledge.
Well, I mean, the tips for combating this virus, first of all, is if you don't contract the virus, you don't have to fight this virus. And that's where Dr. Khaldoun and all of the Michigan leaders who have been leading this effort to combat coronavirus comes in with the social distancing, advising people to use face coverings when you go out in public, frequent hand washing, and all of the other measures as far as keeping yourself out of harm's way by not contracting this virus. And that's obviously the most effective way. Prevention, obviously, you've heard an ounce of prevention versus trying to cure something. Second is to be compliant. If you have chronic health problems with your medications and your diet and treatment regimens, to try to stay healthy so that if you do have to battle this virus, you maximize your chances of surviving.
Okay, and then so I'll turn back to Lieutenant Governor Gilchrist. I know you provided us with a really good update about what the task force has been up to, and if the public wants to find out more about the task force or have find out what the task force is up to, is there a website or a link that we can direct them to?
Yeah, there is. It's like one of those websites that is not easy for me to like say here. But what I'll do is I will put it into the chat here on the Zoom, and then I'll make sure folks we can email or send a link out to it after the session, because it's just like a lot of letters, and I don't want to spell it wrong for you to be able to communicate it. But yes, it is on the Michigan Department of Health and Human Services website. There also is linked from the michigan.gov/coronavirus website, which is our primary source of information from the state about what is happening with the pandemic and our pandemic response. But I'll make sure that folks get a direct link to it.
Okay, and then Dr. Khaldoun, you heard my question for Dr. White. Do you have any basic tips that you can provide us for combating the virus, or any specific tips for African Americans?
Yeah, I think as Dr. White said, the most important thing is prevention. We all know there is no vaccine for this disease. There is no antiviral treatment, unlike the flu. And it's also much more infectious based on data we're seeing thus far than the flu. So all of these things that we're talking about, social distancing, still, if you don't need to go out of your house to do things, don't go out. If you do go out and you're going to be in a public space, wear your mask. You're protecting others from getting the disease if you might have it. Washing your hands frequently. Those are still the most important tools that we have to fight this virus. It's not getting it in the first place.
Okay, and then Dr. White, can you, again, I've talked about this issue about misinformation out there. Can you talk to us about, how do the doctors determine whether the medical information that they get, and Dr. Khaldoun, we'd ask you to chime in as well. whether the medical information that you get is accurate. I mean, there's this, there's been this discourse in the media about the proper medicine, the proper treatment for COVID, and can you elaborate on that?
Well, as far as how do you get good information, one is you can actually go online and go to authoritative sources such as the CDC's website. Anyone can go on there and you can get very reliable information. As far as for a medical professional standpoint, I use trusted journals. I use the CDC resources for updates as well as the, as far as the state of the time, knowledge of this virus that keeps evolving every other day and week. And I'd say you can contact your own physician, like being in touch with your doctor. Now, telemedicine has been dramatically increased and it's reimbursable now. So you can actually have office visits with your doctor without having to leave your home. And that also can minimize your risk, and still you can get good information as far as if you're having any symptoms or something that's worrying you.
Oh, okay. And then Lieutenant Governor Gilchrist, is there, I know you said that you'll direct us to a website, because I also wanted to make sure that there's a place where the public can go to ask questions and give comments as far as the task force. So you said that you'll get us that information so that we can distribute that?
Yeah, I'll send it to you. Just going to be easy to read off. We do have an email address that folks can use also to send us not only questions, but also the task force needs ideas. It's going to take big thinking and aggressive thinking and creative thinking in order to do the two things that we are setting out to do, in order to respond in real time. So for example, if you have an idea about a way that we can, or about protocols that we can implement, for example, that can enable people who are using public transportation to be safer. Because one of the challenges that we have, for example, is, where we've asked people to limit their trips that are unnecessary outside of their homes. But you got to eat, so you got to go to the grocery store, right? Well, some people can't afford to buy hundreds and hundreds of dollars worth of groceries and then not go to the store for a month. So, if they don't have a car, you have to take public transportation 2 or 3 times a week to get to the store. And so you're putting yourself at risk. You're putting your potentially the bus drivers and the professionals who are working in the transportation system at risk, and those folks who are working at the grocery store at risk and repeated exposure. And you got to do that multiple times a week there and back. So, folks may have ideas about how to intervene there, what kind of protocols to put in place. What can we do? Maybe there are programs that we can look at to make it so we can deliver food to you in a more effective manner so you don't have to leave to get it, but you can still get the sustenance that you require. So we need those kinds of ideas. And I saw my colleague, Deion Williams, has put the website for this task force into the chat. Maybe he can do the same with the email address, but I'll read it off quickly because that one's pretty simple. It's just MIEOG, which is Michigan Executive Office of the Governor, dash COVID-19 Racial Disparities Task Force. MIEOG COVID-19 Racial Disparities TF at michigan.gov.
Okay, all right, that's wonderful. And then Dr. Khaldoun, I also wanted to ask you, I've been watching avidly when you and the governor get up and give us updates about the executive orders and what's going on. And I definitely applaud you, and I applaud the governor for having you as the doctor come out and who went to medical school. I mean, we're lawyers. We went to law school. If you have a legal issue, go to a medical issue, you go to a doctor. My mom's a nurse. So, but the question I have for you is, how, as far as I'd asked Dr. White, like, how can we make sure that we're getting accurate information? How do you as a doctor make sure that there's accurate information out there?
Right. So I'm a practicing emergency medicine physician as well. And so as Dr. White mentioned, we tend to go to credible sources. So obviously the CDC, but also we look for things like randomized controlled trials and making sure things are peer reviewed by other clinical peers when something gets published. I think it's really important that people look to your clinician, your physician, as Dr. White said, when they're looking to see what medications they should be taking. Are there treatments for COVID-19? I've seen a lot of misinformation out there. And so it's important that everyone goes to credible sources for information.
Okay. And Attorney White, did you have any other questions that you wanted to ask?
Yes, Lieutenant Governor Gilchrist, what are the key areas that the task force is specifically focusing on, such as i.e. healthcare, education, employment, and or the criminal or more the criminal justice system regarding this issue?
Yeah, yeah, I appreciate that. So I'll break it down in a couple of things. One of the ways we tried to structure the task force's work is to ask some of our folks who have a lot of specific expertise and specific connections to the community. And so we've asked them to focus on specific issues. So we have a task force subgroup that is working on testing accessibility. So one of the things that, frankly, the full force of the state government has been working on is increasing our state's testing capacity. In the beginning of our response, we did not have enough tests in Michigan. Frankly, we still don't. There were not enough tests anywhere in the country due to the absence of a national strategy from the federal government to make sure we had enough tests. But as we have worked really hard and gotten creative and put in place plans that even the feds have responded to positively to increase our testing capacity, we then have had to look at how can we make sure that testing is accessible to the communities who need it most. And there have been a number of steps taken in that regard, not the least of which was a major one that was announced by Dr. Khaldun in the most recent press briefing, talking about the order that would make many more people able to get tests without specific sign off from a physician. That's important because in the beginning, when you needed this kind of sign off, when we had constraints on testing supply, you had a lot of people try to get tested and they were turned away for different reasons. It's one of the reasons why one of the first actions that Dr. Khaldun took after the task force was established was to write a letter to medical professionals in the state of Michigan, alerting them to the possible presence of medical bias in testing and treatment decisions when it comes to COVID-19. And that's one of the most proven interventions to address the presence of bias in decision-making. So in addition to letting folks know that it's there and they should be mindful of it, if we increase more supply, we reduce the need for someone to choose who gets a test and who doesn't. We also have worked in the testing accessibility space to have a data-driven approach to standing up more brick and mortar testing sites, more drive-through testing sites. We're looking to scale up this pretty innovative model where we're using basically specially outfitted vans to go and literally drive full testing capacity to specific zip codes or neighborhoods or specific vulnerable places like a homeless shelter or a nursing home or a jail to test folks there. So this accessibility is making it easy. Now, how do we get tests to people? The drive-through model is something we innovated in Michigan. But again, if you're that person who's relying on public transportation, like you can't take a bus through a drive-through testing site. So we need to find a way to bring the testing to people. Another group has been working on one of these sort of long-term issues, which is one of the factors in the differentiated impact and mortality rate of this virus in communities of color and low-income communities, et cetera, is that people may not have a connection to the healthcare system. You may not have insurance, you may be underinsured, you may not have a primary care physician, there may not be a doctor that's located any place close or convenient to you. And so we're looking at the fact that so many people will be coming into contact with a doctor for the first time or for the first time in a long time in the context of this pandemic. How can we use that as an opportunity to connect them to a primary care physician and connect them to long-term care? That's important because not only will they have someone to partner as they manage COVID-19 should they need to, but also they'll be able to work with that person going forward to put in place a preventative health plan for them, to help them manage any conditions they may have, especially those chronic conditions that are proven deadly with coronavirus, things like diabetes or high blood pressure or asthma, things that Black folks are much more likely to have than others in the state of Michigan. I'm speaking with you from my home in Detroit, next door to the zip code with the highest asthma rate in the state. So thinking about how can we, again, connect people to care long-term is one of the ways that we'll address those sort of long-term disparities. And then the last piece is you talked about some other things, education, criminal justice, et cetera. The state of Michigan has been working to, we are the only state in the country that has tested every person who is incarcerated in a correctional facility, in a state correction facility here. That's important because testing is the first step to treatment. So making sure that we know people's status and can get them the treatment that they need. We are also working to move through to test every person who's in a jail in Michigan. The state of Michigan gave some of the strongest guidance in the country when it came to releasing people from jail. giving judges the leeway to do that due to triggering the Jail Overcrowding Act, so they can treat their jails as overcrowded, making specific recommendations that they release people who are in jail pre-trial, who are in jail for failure to appear, in jail for failure to pay, in jail for nonviolent offenses, or in jail for merely for traffic violations. That's some of the broadest reaching guidance that has been given to any state. We did that in Michigan. And that's something that I think is really important. Y'all may know I led a task force on jails and pretrial incarceration with the Chief Justice of the Supreme Court last year. And that was also part of our recommendations broadly for criminal justice reform. So we've been trying to do a number of things, and obviously the things in criminal justice have a disparate impact on communities of color and the Black community and Latino communities in particular. So we have a lot of work to do, but we've got some great people who are thinking about this in a really sharp and substantive way.
Thank you.
Right, thank you. Yes, I know that Rita and I, Attorney White and I are both criminal defense attorneys, and since the pandemic hit, there's been a number of us that have been filing emergency motions to get our clients out of jail, that have health issues. I know SATO got together, and so there's a big movement underway with attorneys, criminal defense attorneys, to help get people out of jail and prison. I know some of our members, we signed on to a letter to request clemency for Kwame, the former mayor of Detroit, Kwame Kilpatrick, and other federal prisoners that are incarcerated, because we feel that if you've served your time, you're not, particularly if you're nonviolent and you're vulnerable, or you're older, or whatever, we have Black people, we have comorbidities, and just because you commit a crime doesn't mean that should be a death sentence. Obviously, I did talk to Pastor David Loudrin, who he's on a reentry task force that the president put together, and they were saying that they were trying to evaluate, like, on a case-by-case basis, and just look at issues of safety, making sure, like as Kim Worthy and Judge Kinney had to do in Wayne County. I know that, and Sheriff Benny Napoleon, they released a number of people from the Wayne County Jail, but it's a matter of balancing safety, making sure that they don't let anybody out that reoffends, but also making sure people are safe and healthy. And I filed a motion for one of my clients. I know Attorney White has filed a motion for her clients as well. So another question that was asked is about the school situation, because I'm sure you guys have watched in the news. There's been a lot of questions about, is the governor gonna open things up in the fall? And I'll say this again, I can't say it enough. I applaud the governor. I applaud you all for what you've done, because I know there's all this debate about whether you go out or stay. I'm like, no, my mama was the nurse, and it's like knowledge is power. We need to, if it's better for us to be safe, wear masks, that's what we got to do so we can survive. I know you guys have been affected. I've personally been affected. I had a cousin that died. She was 43 and she died from the virus. So can you speak to the issue about the school situation?
Yeah, I'll speak to it on one level, and then Dr. Khaldun, if you want to chime in with a more rigorous response, as you can do, please do. This school situation. Well, let me just back up. I can imagine that all of you have been impacted personally by this. Certainly, I have. I've shared that now 21 people in my life have passed away from this, including the assistant pastor at the church I grew up in, who passed away yesterday. My oldest living family member passed away about 4 days ago from COVID-19. So this is real. Like, this is really real. Now, when it comes to schools, look, I get it. It's real. I got twin first graders in addition to the baby, and so our kids are at home. They're asking questions. They don't understand what's happening. I know it's hard for parents to have age-appropriate conversations about what's going on with this pandemic. At the end of the day, the choices about schools are going to be dictated by the public health reality. So we're working to be as transparent as possible with the sort of inputs into those decisions, our testing capacity, the testing results, how those are trending, the case counts, how that's trending, the mortality rate, how that's trending, the public health infrastructure capacity in terms of basically our ability to handle cases if we see another increase based on activities that are now permissible that were not previously. But schools are tough. I mean, I can't imagine what it even looks like to have a socially distant kindergarten classroom. I don't even know what that means. And so thinking about all of the the not just the children, but the education professionals, the parents, the community members who have to come in and out of a school on any given day. Every district in the state right now has been working on a distance learning plan and for how they can try to facilitate learning at distance right now. But when it comes to the fall, it's going to require some creativity and understanding, but that all needs to be grounded in what the public health reality is. And right now, we cannot predict what that's going to be at the end of August. We can't predict what that's going to be at the beginning of September. So I know that we all are searching to have some kind of certainty or knowing what's going to happen. And there was an editorial in the Free Press that spoke to this, that really spoke to me as a parent, talking about like, we don't have the answers yet. And we need to like understand that we don't, and that's difficult. But what we're trying to do is be conscientious and methodical about how we're approaching these kinds of choices. Just like we approach the choice about enabling certain types of manufacturing on a limited basis, enabling certain types of outdoor professional activity on a limited basis, enabling activities in certain parts of the state on a limited basis. We're gonna have that same approach when it comes to education. We also, I guess, finally, we have established a return to learning task force that actually had like literally 1,600 people applied to be on that task force. This is obviously a topic of deep interest in the state of Michigan. And so we'll be making the announcements about who those members of the task force are going to be. And that is one of their primary responsibilities, to look at what will it mean to return to learning? Will it mean full-on face-to-face education again in the fall? Will it mean some hybrid or blended learning model that's scaled across the state? Will it mean more distance learning depending upon where you are? How do we support that with infrastructure like internet-enabled devices and internet connectivity, something I've been personally involved in our state response thus far? It remains to be an open question, and we don't have an answer as of yet.
Yeah, I know. I work as an educational advocate, and we've had to adjust with some of my clients, you know, as far as going from being in the classroom online. And so there's a number of issues, you know, as far as even general ed students. I know Ben Crump, I teach a class, and we were talking about, he was talking about a way to equalize education for African-American children was to definitely help with the internet and laptops, things like that. So I have a question for Dr. White, Dr. White and Dr. Khaldun about the swimming pool issue. And somebody said to me this morning that there was a situation with some kids that were in a pool and that they got sick. But Dr. White, start with Dr. White and Dr. Khaldun. Can you give your opinion about, do you think it's safe for people to go into swimming pools or?
Well, I think that at this point, no one knows for sure. What I've been looking at, the advisories from the CDC they direct you to your local healthcare officials for advisements. But once again, for the same things, like if you socially distance and don't take a chance, personally, I wouldn't go swimming in a public swimming pool at this point, because I don't think the answer is really definitively known. We know that heat, humidity, and ultraviolet light, these are things that attenuate this virus in particular. So, I mean, you have plenty of water in a swimming pool. You don't know necessarily how well some of these pools are maintained, but the chemical additives, in theory, they may help attenuate the virus. And in the middle of summer, that may help as well. But I think really you're sort of taking a gamble if you do something like that right now. I personally wouldn't advise anyone to participate.
Okay, and Dr. Khaldun?
Yes, the CDC actually put out some guidance about public pools for the summer, and absolutely, Dr. White is right. The point is, there's never zero risk. And while it's safer to be, for example, at an outdoor pool versus an indoor pool, just because of the air circulation, if you will, it's still, the more you are giving yourself an opportunity to be in close contact with other people, the more you're going to be at risk of getting the disease. And you can think of it from a cumulative perspective. If you're going to the store, if you're going out to work, if you're in a close crowd, those are all opportunities where you will be more likely to get the disease if someone else is close to you and has it, or you're touching a surface where someone has it. So I think, unfortunately, we don't know right now where we're going to be in a couple of months, as Lieutenant Governor said. But right now, the more you can protect yourself, the better off you would be. And so at this point in the state of Michigan, we're not quite opening the public pools yet. We'll continue to look at the data, as the Lieutenant Governor said, and make a determination as far as the risk. And really what we're talking about is moving from categories of risk, whether you're low risk, medium risk, or high risk. And unfortunately, you can easily move backwards to higher risk categories just by those close interactions, whether it's a swimming pool or barber shop or other places. So we really have to be careful right now.
Okay,
Okay,
so Dr. Caldoun and Dr. White, I have kind of a twofold question for both of you. First, with Dr. Caldoun, what suggestion would you give to the public about getting accurate information about what works and what does not work to help prevent, or, well, there's no, what to help prevent COVID-19?
Yeah, so that's a great question. I would say first and foremost, talking to your physician before you go and try to get a medication or take whatever alternative medication. Just talk to your physician first about that. I think what's been somewhat concerning for me as we've seen this pandemic roll out is that I think people are really, really wanting to find a cure, and people are really, really wanting to find that one pill that will save us all. And we're rushing to do things. And it's important that we not let science and data go out the window. For example, the hydroxychloroquine. Of course, if there's any opportunity that someone may get better with the medication, we want to identify it, but we need to wait for the research. And unfortunately, sometimes these medications can do more harm than good. So we want to make sure that we have the research, whether it's a medication or a vaccine, that we have the research available before we suggest that people take it. And we're continuing to do that. There's a medication called remdesivir that we've seen some early clinical trials that suggest it may improve outcomes for a subset of individuals with the disease. But again, that's still not FDA approved. I would recommend that people really wait for the science to catch up before they start rushing to these various treatments.
Okay. Dr. White, do you have any comments regarding that question?
I think she gave a great answer. I don't have much more to add to that. I just think that overall, it's just important for people to try to be healthy in general, a healthy lifestyle right now, plenty of sleep, good nutrition, and avoiding potential contact with this virus outside of your home.
Okay, so now, Dr. Caldoun, there was a question asked that, do you recommend that people who have tested positive be retested after a specific period of time to confirm that they are COVID negative? I guess that relates to the whole antibody issue. Has there been any follow-up in terms of the research regarding that issue?
Right, so right now, it's a great question. So there's really two things there. So once you have COVID-19, there are really two ways that the CDC has recommended you could be released from isolation, if you will. And so that relates to things about your symptoms, how long since you've had symptoms, and how long you've been fever-free. So 10 days without symptoms improving, 3 days without fever. And for those reasons, again, I don't want to make this too complicated, but those are the ways that without a test, you might be able to get off of isolation for us to know that you are not infectious to other people. There's another way, which is basically having 2 negative COVID-19 tests once you've already been diagnosed as positive. That's another way that you can be tested, if you will, so that people know that you would likely not infect other people. That's a different question than the antibodies that you brought up, and that's a very important point. So there are many tests, broad numbers of tests for the coronavirus. There's things that will diagnose you with the disease, and that is called the PCR test. And then there are tests like the antibody test that you're describing that really don't tell you necessarily that you have disease right now. They don't tell you that you have the disease right now. They tell you that you might have been exposed to the disease in the past. I think there's a lot of questions. There's a lot of questions right now about these antibody tests. One, there may be cross-reactivity, so you may get the test done, but there are other types of coronaviruses that infect humans, including colds. So you may have an antibody to a cold virus, and you may think that it's because of COVID-19, and it's actually not. So that's one issue. The other thing about these antibody tests, we don't know if you have the antibody in your blood, and it's just a protein that's in your blood. We don't actually know yet if that protein actually means you are actually immune and you could not get the disease. So I'd be very careful of people getting an antibody test, having it be positive, and assuming that you are actually immune to the disease. And then finally, even if you do have that antibody, and let's just say you are immune to the disease, it it doesn't tell you how long you would be immune either. So when we talk about these antibody tests, it's important that people don't have a false sense of security. If you've been exposed to someone with COVID-19 and you have an antibody test, you still need to do the appropriate 14-day quarantine. It should not be used to determine whether or not someone should go back to work. So we really have to be careful about the different types of tests that exist and make sure that we understand the science as far as what we should do as individuals with our test results.
Okay, so now as we've discussed, there has been information provided that unfortunately people of color have been hit with this disease disproportionately. So in terms of what specific tips, or first let me ask Dr. White and Dr. Khaldun, you can kind of bounce off of each other. What do you believe is the reason why there is a disproportionate number of people of color, specifically African Americans, that have been hit with this disease versus the other races and ethnicities?
You want me to go first, or you want to?
Go right ahead.
Well, I mean, there are a number of reasons, but what we know is that with high population density, this virus will spread faster. And then also with chronic health conditions, the virus has a higher likelihood of manifesting severely, and also you have a higher likelihood that a person may die. In urban areas where you have high population densities and you have a lot of people living in food deserts, it's a setup where people in that type of a living situation and that demographic, especially if what happened in this situation, very early on, many people in many localities, not just in Detroit, but all over the country, were very skeptical as to how serious to take this virus. And because of those types of factors, I think that, the virus, we know, not just with this coronavirus, but health outcomes, as well as the cost of medical care in the Southeast Michigan and the Wayne County area have been historically higher and just in general across the board for chronic illness. So when you throw in something like the coronavirus, I think that this is one factor. I don't necessarily think that it's really just an issue of race. A lot of this has to do with the socioeconomics that have been plaguing the Black community as far as the effects of discrimination, access to high quality food, just all, shelter. All of these factors are all things that sets people up for having adverse outcomes. So with the reality that we're living in, that in a situation, especially like Detroit and the Detroit area, where you have a lot of people where they're living sort of like a lot of people in small areas and who have these problems, they, the vigilance, have to be extra vigilant. I know that in the Detroit area in particular, the coronavirus rates have dropped off so drastically in the hospitals. A lot of people have been surprised just how fast the rates have come down, which is good news in this situation. But I think those factors play heavily into why we've seen this very big disproportionate impact as far as with the people of color, especially in the Detroit area.
Dr. Khaldun, thank you, Dr. White.
Yes, and I would just add to what Dr. White said. I think especially early on when we had closed a lot of parts of our economy, what you saw was that people who were quote unquote essential workers were still having to come out and work. And disproportionately, people who are essential workers, so working in the grocery store, other kind of low income jobs, they still had to come out and work. And unfortunately, those are people who are disproportionately going to be people of color. And when you talk about a city like Detroit, where a lot of people don't have access to an individual car, right? So they're having to go out to work in the first place, and then they have to take public transportation. Again, I spoke earlier about there being cumulative risk. The more often you have to go out, the more you have to be on public transportation. Those are things that are going to make you at higher risk for getting the disease. And as Dr. White mentioned, if you do have these underlying chronic conditions, you're going to be more likely to get more severely ill and pass away from the disease. I'll also add, when it comes to COVID-19, if you have the disease, the most important thing we can do to prevent its spread is to isolate and quarantine. And if you look at the CDC guidance, it talks about use your own separate bathrooms, stay separate from your other family members. those are not things that are easy to do for people who do not have the means. And we talk about housing and access to housing, and even just culturally, some families just living across with multiple generations in the home. It's not easy to just say, go use a separate bathroom. So those are some things, in addition to what Dr. White said, that are contributing to the significant impacts in the community.
Okay, thank you, Dr. Khaldun. I'm going to refer this next question to Lieutenant Governor Gilchrist. Now, is the state of Michigan currently hiring more unemployed workers? And if so, how can they have family members, how can their family members apply for these jobs? And will these jobs be temporary under the current circumstances? And if so, for how long?
Thank you for that question. The issues surrounding unemployment in Michigan are absolutely like nothing we've ever seen before in the history of the unemployment system. And we are working every day diligently. Our Department of Labor and Economic Opportunity, where Unemployment Insurance Agency is housed, we've added, I think the last count was like 750 more people who are trying to answer the phones. We've added capacity to the website to deal with this significant increase in people who need unemployment insurance, who need to take advantage of the leadership role that the state of Michigan has played, frankly, in ensuring that our unemployment insurance system could quickly handle things like gig workers and self-employed workers and 1099 contract workers. We were one of the first states to implement the pandemic and unemployment insurance, which is the extra $600 a week on top of your regular unemployment benefits that was passed in the CARES Act. We were one of the first states to implement that. So we're working on getting through this backlog of people who are making their initial claims, people who are certifying, people who need to have follow-ups because there were specific issues or questions with their claims. And we're trying to pound through that. We are, so I think that folks can go to the same channels that they always go to as far as looking to apply for jobs in state government. I can't speak to whether the jobs are temporary or permanent at this point, but I think if folks have the ability to step up to be able to help in this is an all hands on deck moment in the state of Michigan. So we certainly would appreciate folks putting themselves forward.
Thank you. Okay, so I'm going to direct this question to Dr. Khaldun and Dr. White. We hear a lot of different ads on TV, social media on how this virus is contracted and whether or not someone who has it or has had it in the past can get it again. We talked about the antibody issue earlier, but can you elaborate on how that actually works? Has it been determined whether if you have the antibody, you cannot contract the disease again?
All right, so a great question. And again, this is such a new virus. There's still so many studies going on. So we don't 100% know if someone's had the virus, if they can get it again. It could be, for example, like the flu that people can get multiple times. There's a vaccine. We know the flu mutates every year, which is why we have to develop a new vaccine every year. Those things are all very, very new and just unknown right now when it comes to COVID-19. What we do know, though, is that people can have no symptoms and still be spreading it to others, which is another one of the reasons that people should be wearing a mask when they're out in public, because you can still be spreading it and not even know it.
Okay, Dr. White?
Yes, I agree with all of that. So as we know, well, as far as COVID-19, it's a coronavirus. Coronaviruses in the past have not been known to induce long-term immune responses in people. And usually the immunity doesn't last much longer than 2 years after an infection. So if this coronavirus is even similar to other coronaviruses, then in theory, then maybe you can get it again. But as Dr. Khaldun already said, the answer right now is just unknown. So you should still be safe and you should treat yourself as if you have not had coronavirus, even if you've had it and recovered, because you could get it again.
So now there's another question, Lieutenant Gilchrist, Lieutenant Governor. We have seen disproportionate responses to issuing citations in the urban areas as opposed to Lansing and non-urban areas, suburban areas, relating to social distancing violations. Is this something the task force is addressing regarding this local issue?
Yeah, I appreciate this, and this is a real concern for me and for a lot of people in communities across the state. So the short answer is we tried to be conscientious about this in a few ways. One, we wanted to make, one thing I was particularly concerned about when we issued, as part of one of the iterations of our stay home, stay safe order, the requirement for people to wear a face covering when they were leaving their homes. It was very important to me to make sure that there was a specific and explicit connection made that the people who were wearing face coverings would have the full protection of the Elliott Larson Civil Rights Act, which is Michigan Civil Rights. Well, why am I saying that? Y'all know what that is. Y'all are all lawyers. I'm the only lawyer not on this call. But that was important to me because, like, look, as a Black man, like I was like kind of concerned about going out of my home with my face covered, and you know, people making an additional set of assumptions about me than they already make when I leave my home. So we wanted to make sure that people were aware of that. We gave specific guidance to the Michigan Civil Rights Commission to law enforcement agencies across the state to remind them of that and give them guidance about how to approach their jobs in that reality. You know, one of the challenges has been that while we have had the authority to issue these orders from our office and the office of the governor, when it comes to enforcement, we are reliant upon local law enforcement. And so what you've seen is some of the same challenges or some of the same biases when it came to approaching law enforcement and differentiated enforcement have shown themselves here in the context of this pandemic and the law enforcement issues associated with it that are present in law enforcement in general. So there's something that we are looking into both as an administration, even broader than the task force. This is an administration thing. How do we work with local law enforcement? You may have seen that we've had law enforcement officials and sheriffs in certain parts of the state just straight up say they're not going to enforce things. So no, and it's not just folks in northern Michigan that have said that. The sheriff of Genesee County made a statement to that effect toward the end of this last week. So there's a significant amount of authority that's delegated in terms of how these orders are carried out, and we're working to figure out how we can make sure that's not differentiated. The last thing I'll say, because you didn't ask it directly, but it is connected here, is the issues that have been happening in terms of the protests at the Capitol present a unique set of circumstances and a unique set of challenges. I certainly I never thought that as the Lieutenant Governor and President of the Michigan Senate that I would govern and preside over a body in a session where we had a guy wearing a Confederate flag on his face, or never thought I would preside over a session where you had men with long guns in the Senate gallery intimidating lawmakers. But that, unfortunately, the Republican-led legislature had the choice to make if they want to do the right thing to limit that kind of behavior. There's been a censure resolution passed or introduced for that senator who did that, senator from the 17th district. And the Capitol Commission has the authority to be able to ban guns in our state capitol, so that we would no longer be one of the 2 states that allows the open carry of firearms in the Michigan state capitol. And that is before them, and they have the opportunity to do the right thing there. That is actually outside of our purview. But we want to make sure that people are treated fairly and safely, and that clearly has not happened in a consistent way. And so there's something that we're working on pretty much daily.
Yeah, I know that's the big, I'll say that. I mean, we've had a lot of, amongst the criminal defense attorneys, we've talked about that, about the disparity of treatment. I mean, before the pandemic, there were issues with African-American males primarily that would get caught up with guns. You know, they think in Michigan it's open carry, but they don't understand that if you can't have just a gun in your car without a license to carry. I do videos on what to do when stopped by the police. I'm sure I'll be updating them because we've got this issue about the mask. When you go into places, can you wear a mask? How should you do it? How can we all do this safely? And then, you know, some places that are requiring masks, I'm like, I feel like, okay, are they going to provide a mask? If they say, okay, you're going to provide a mask, and then say you need to wear it, but then just to require somebody to wear a mask and you don't provide it, I don't think that's fair. So yeah, we definitely will be wanting to follow up on this, because a lot of people were upset about what happened with Lansing. Again, we feel the governor she's got wise counsel. She has you guys there helping. And then you have these people coming with guns, and then there are a lot of people like, well, Black folks did that and came to the Capitol, they would have gotten in trouble, and it's a disparity of treatment for white folks. And that's why when I do my videos, I talk and I bring some of the judges. We have some of the judges here, Judge McClinton on the link with us here. Is we talk about what to do when stopped by the police. You know, I partner with the sheriffs and And I anticipate we're going to be doing some updated what to do and stop by the police in light of the pandemic, so people know what the rules are, just like with expungement, things like that. And I know we're getting close to time. I know another question that we wanted to ask you is, for us as an association, we're Black women lawyers in Michigan. We have lawyers in different areas. And, you know, for the pandemic, we've been trying to figure out what to do. We got it on social media. You still see, bear with us. We're learning the social media. Garland, we may be calling you because we see you have that social media, you have that tech background. I saw your bio, but we're working it out. We did Ask a Lawyer. We're planning to do more programming. But what we want to know as a membership, what can we do? Is there any way that we can, like, we want to be on task force or committees with the governor's office and be more directly engaged with helping the public, or helping, just to make sure that the governor continues with her goal of doing things properly, not just rushing out there, but making sure that we're safe. I mean, you look at the pandemic from 1918 and you look at now, and I believe, you look at the map, you guys have saved people, and you have to listen to wise counsel, and that's what we believe she's done. You've done that. So is there something that we can do? Because a lot of people have asked, like, what can Black women lawyers do to help with this situation?
Yeah, I appreciate that. I mean, what you're doing, what you talked about, is important in the beginning here, which is making sure that you are available, because people will have a lot of legal questions about what's happening now, and they need help interpreting that. So I think that is important. Something else that you might not have thought about that you can do that's helpful is, I'm sure y'all are aware that our authority to take these actions in the name and interest of public health, which, by the way, protecting public health and public safety is our primary responsibility as public servants. And our authority is constantly under question from, frankly, partisan sources that are more interested in challenging the authority of our administration than in actually saving people's lives or livelihoods. And so one of the things that we could use help with is for you to to participate in those proceedings. I don't know if it's like amicus briefs or whatever it is, so that you can speak to how these responses have been, the actions we've been taking have been in the best interest of the people that you serve as your clients and the communities where you live and where you work, showing that this matters and why this authority matters. I mean, just for the sake of example, how you know this is partisan and about authority and it's not about public health is, in the context of this pandemic, we have also dealt with a once in 500-year flood in Midland County and the surrounding areas, right? And the legislators who represent those areas in the state legislature are mostly Republicans, and they have been clamoring for emergency declarations to be declared in their communities. And these are literally the same people who are challenging emergency authority when it comes to the public health response to COVID-19. So
right.
That's how you know this is about politics, not about people and public health. And so I think you can help us in terms of sort of intervening or briefing or communicating why you believe that these authorities matter, because without them, we don't have the ability to take the action that we've taken. That I agree, and I think that is substantively, quantitatively true, where even though we have lost a tremendous amount of life in Michigan, we have saved a lot of lives too. And so we certainly need your help and your specific expertise to help with that.
Yes, that's a great response. That's all of sister attorneys. You all heard that, right?
And Rita is an appeals attorney. I'm gonna put it out there. Rita does appeals. Attorney Rita White, the president, does appeals. So just let you,
Yeah, because when the first lawsuit that we heard, there was a lot of social media activity, and there were people offering to write amicus briefs, and we were on it. So that's something. Thank you for opening that up as an opportunity, because we know our community, we're all together and we're all affected by this one way or the other.
For sure.
So I'm going to close off with a last question. It's a medical question for both Dr. Khaldun and Dr. White. Now, succinctly, can you tell us what health conditions, if you're aware, can put a person at greater risk for contracting COVID?
Sure, I can jump in here. So,
Oh
You
no,
want to start? Okay.
please go ahead.
All right. So again, we're still learning a lot about this virus, but anything that would make someone have like diabetes, high blood pressure, COPD, certainly anyone who has a weakened immune system, whether because of taking medications or they have cancer. So those are some of the conditions that would make someone at higher risk of either getting the disease or having a more severe outcome from the disease. And I'll turn over to Dr. White as well.
Yes, all of those things are exactly correct. And also, as far as health conditions, but health habits are also very important. So, like diabetes, heart failure, these things, but also smoking cigarettes is very dangerous right about now because it impairs your innate immunity to resist this virus if you do come in contact with it. Just because you come in contact with a given germ does not mean it will set up infection, but smoking really causes damage in your airways. Vaping can damage your airways. And these types of things, in addition to chronic health conditions, can really increase your risk. So, people have even more reasons why they shouldn't be smoking. And I would even say potentially even smoking things that people like to, like now, a lot of people are into marijuana, but even though it may be okay at the state level, but anything that you inhale can impair your body's ability to protect you against any germ, including this virus.
And just lastly, Dr. White, do you have just a brief, statements on what tips can you provide for them to overall, what can they do health-wise to prevent contracting this disease, to keep their immune system strong and to avoid contracting the disease?
Well, I mean, just general healthy lifestyle habits. And so, as far as general eating, like just to get somewhat specific without being very specific or overly specific, one is refined sugar. It impairs the immune system. We know that very well. So basically, trying to avoid eating a lot of sweets. And then two, getting, in addition to getting good sleep, getting limited amounts of exercise, maybe 20 or 30 minutes worth, like, 2 to 3 times a week. Not necessarily going to the extreme degree, but that also can help boost your immunity and help you just stay healthy in general. But obviously, the social distancing, that's the primary mechanism that we're using right now, and that's being advocated by the state and all of the public health authorities. So, but
Is vitamin C, taking vitamin C, is that an effective?
I mean, vitamin C is good for the health. I mean, it's known to potentially have some immunostimulatory effects. Well, that's good. Vitamin D, in theory, is also very important for immunity. Um, so that all of these general health habits are good, like maybe just doing a multiple vitamin and then eating, your recommended amount of fresh fruits and vegetables, but just trying to eat healthy, good sleep. And also don't just become sedentary while you're at home, confined all this time. Try to do a little bit of exercise periodically.
Okay, well, thank you so much for all three of you panelists, dynamic panelists. We have received so much very important, refreshing, very stimulating information. So I'm going to close this out by offering, I would like all three of you, each of you, to give a closing statement, about 2 minutes, just your thoughts about the current issue and what you would like to provide us in addendum. Lieutenant Governor Gilchrist.
Thank you, everyone, for, again, this forum, the information. Thank you for being beacons of information in your respective communities. This is exactly what it's all about and how we can serve one another during this time. This is a pretty dark night, but I am reminded of something during this time. I'm struck by the irony of the social distancing that we're all participating in, that it reminds us how connected we are and it magnifies the value of our connections and our relationships. It shows that we all are reliant upon one another. It shows that the individual actions that we take and choices that we make have a direct impact on our collective well-being, and why we must all think larger than ourselves at any given time. I think that this is going to lead to us coming through this pandemic and then emerging from it ultimately with stronger relationships and stronger community connections. We're going to value our in-person time more. We're going to say I love you a little more forcefully. We're going to be much more consistent with how we check in on our people. We're going to take care of one another differently because we will be the generation that survived this pandemic. And the way we is by staying closer to one another. So that is the ray of sunshine that I look to when I wake up in the morning, and when we ultimately emerge from this dark and stormy night. That's what we will cling to as a people. So thank you for playing your roles in that, and we will get through this by working together.
Thank you. Dr. Khaldoun, I think Rita, you muted yourself, but yeah, Dr. Khaldoun.
Yes.
Have
So,
Dr. White and then Dr. Khaldoun.
okay.
You'll be the last. The final.
Okay. All right. Yes. I would like to thank you all for having me to participate. I'm happy to, give whatever input that I've given that may be helpful to anybody out there. And as this coronavirus pandemic, this is unprecedented. No one I know I didn't expect this to happen. This is like really sort of unbelievable. It's sort of like the Twilight Zone, but it's real. And I agree with what Lieutenant Governor Gilchrist said. I think that this shows us just how much, we are interconnected. And I miss being able to, be around my family and friends the way I used to. I'm sure everyone is feeling that about now. But I do think that it is important for us to persevere and to continue to socially distance ourselves and practice good hand hygiene and sanitary practices, and just try to be healthy and safe, so that we all come through this together.
Thank you. And last, Dr. Khaldoun.
Thank you. No, it's really just been a pleasure joining the conversation today. So thank you for inviting me. I'll just say that, as Dr. White and Lieutenant Governor said, this has been an unprecedented crisis. And I'll just say from a health perspective, it has really just emphasized the fact that even before COVID-19, we had health disparities when it came to maternal and infant health, when it came to diabetes, when it came to heart disease. And we were in the public health and medical field. We always knew this, and we were always working to try to address it. And the COVID-19 has really just elevated all of those issues even more so. And I don't want us to also forget about mental health and how important that is. So as we're talking about social distancing and washing your hands and making sure you don't get the disease and that you get a test and treatment, don't forget about the mental health. You can't cut off your head from the rest of your body. And so as we continue to move forward with addressing this pandemic, we're going to have to make sure we deal with mental health, with substance use disorders, and then those social determinants of health that we've been talking about as it relates to poverty and jobs and homelessness and access to care. All of those things are going to be incredibly important as we continue to address health equity in our communities. So thank you for having me. And I look forward to continuing to have conversations with all of you.
Thank you. And I really hope we can continue this dialogue. We really want to make sure we're all on the same page and we're all communicative wise. We know what's up to date going on with this whole pandemic. So again, I hope us sisters attorneys can hear the notice that we need to start the legal parts. We need to make sure we put ourselves in there to make sure we keep the toxic issues out that make us more healthier. So again, thank you, Dr. White, Dr. Khaldoun, and Lieutenant Governor Gilchrist. And we hope that you can join us again in another presentation.
Thank
In
you.
a better
Thank
light.
you.
Thank
Thank you.
Thank you.
Take
Thank
care,
you, everyone.
everyone.
Thank you.
Thank you.
See you later, Garland.
Bye.
Right.